Thank you for the question. And I was horrified to read reports initially out of Quebec and most recently, of course, out of Ontario about the challenges in the long-term care facilities in those two provinces. And when we were sworn in as a government back in 2017, we took to heart the work of the seniors advocate who had put a pretty exhaustive report in place talking about long-term care facilities and the inadequate staffing in those facilities to meet the basic number of hours required to meet provincial standards. So the previous administration put in place standards and then proceeded to not meet them. So Minister Dix was tasked with improving the ratio of time per patient, and we were fairly successful at that with more work to do. Adrian can talk about some of the details around that, but our focus was making sure that our elders, our seniors, got the dignified care that they deserve in the last years of their lives. As we go into the pandemic, we've discovered, of course, also that there was insufficient compensation for some care workers who were finding themselves working at 1, 2, and sometimes 3 facilities. So very early on in the piece, Minister Dix and Dr. Henry took action to restrict that, to ensure that we were not having transmission from one facility to another when it comes to COVID-19. On the broader question of public confidence within our long-term care facilities, I can say with great certainty that the providers are giving the best care possible under extraordinarily difficult circumstances, and the horror stories that we're seeing out of Quebec and Ontario are not being duplicated here in British Columbia. I don't want Adrian, you want to add something to that?
Thank you, Premier. Just to make a few points. As the Premier has said, that when in 2017, and this has been supported across the political spectrum, there were 95 care homes in British Columbia under what's called 2.9 hours per resident day. There are 0 now. The government introduced Bill 47, which got rid of Bills 29 and 94, which drove a system where workers in healthcare had less rights than in other areas, and that was supported unanimously in the legislature. We've added healthcare assistance seats, which is critical because there are human resource questions in healthcare. We've started programs including a new dementia village, which we've launched in Comox. Since COVID-19, and I think just join the Premier in expressing our extraordinary appreciation to all those people working in healthcare, working in care homes, and working in the health authorities who've brought in measures to deal with the terrible effects COVID-19 can have on care homes. It's true that in care homes and in assisted living homes, 4,000 to 5,000 people have died in Ontario and Quebec. That number is still unacceptably high in British Columbia. It's 92, but it's still unacceptably high. And the measures taken to ensure that all care homes have access to PPE, not just health authority owned and operated care homes, which was very important, restricting visits in long-term care, the work of infection control practitioners who were brought in, the rapid response teams that were brought in, and of course the single site order, which has been implemented now in 499 out of 545 eligible homes. So all of those measures are taken. This is the direction we received from 2017 from the Premier and certainly now, and I want to praise Dr. Henry and all those involved on the ground who have made this happen. Are care homes in British Columbia perfect? Absolutely not. We have to continue to make improvements. But I'm very proud of the work our teams have done and very sorry for all those as well whose family members have died before they should as a result of COVID-19.